Hi folks, thanks for tuning in. I have a few questions. So I was looking at these videos. I think I need to get some sun. I'm starting to get a little pale here in the Midwest. Or maybe it's the lighting. Maybe the lighting is washing me out. Anyway, okay, here's the first question. We just had a baby at U of M. He recently had heart surgery and we were referred to you because of your experience in critical care. Can we come to you and can you talk to the doctors here about our son? Yeah, sure. Easy enough. So we take care of all kids here. Michelle, Lauren, Kim, or I. We don't discriminate. We don't discriminate based on color of the skin or disease process or what you need to have done. Our job is to help you. So we do take care of children that have heart defects, kids that have tracheostomies, kids that have G-tubes, kids that are on ventilators chronically, premature infants, and special needs kids. So yeah, we take care of everybody. Come on over. I'll be glad to talk to whomever. I assume you just want me to get us to get signed up from the specialist so we're all on the same page. Not a problem. Next question. Hey Dr. Pappas, my son is 9 years old and one of 4 siblings. Since I can remember, he's been afraid to be alone. I've never made it a huge issue because I felt I would make it even bigger if I did. I assumed that with time he would outgrow this fear. However, it's not gotten better. In fact, it's beginning to make some things harder for him. He doesn't want to be in the bathroom alone. He manages to talk his younger brother into sitting in the doorway when he needs to shower or go to the bathroom. He won't go in his room to get dressed or play alone either. When I ask him why he's afraid, he denies that he's afraid and gets embarrassed. Do you have any suggestions on how I can help my son? Sure, yeah. Well, first, I think we all have something that we need to work on, even as adults. Anxiety, overeating, depression, drinking too much, laziness. I know we all have some quirk about us, whether we're a little kid or an adult, that we all need to work through at some time in our life. And generally we try and do it with love and support and positive reinforcement, some emotional support from primarily family and friends to help us get through it. So it sounds like you've tried to help him. He's 9. It's getting to the point that it's compromising his life. Sounds like it's affecting him. He's affected, you're affected. And you need to go to someone that can help you. Someone that specializes in dealing with children with fears and anxieties and will help not only the child, your child, but will help you help him deal with it. So that would be counseling. You just need to go to the right counselor that deals with children and these types of issues, which is not a big deal. I mean, he'll get through this, so it's not a concern. It's just like anything else. If you have to fix something, you have to have the right tool. And for all of us too, if we have issues or some problem that needs to be addressed, you need to go to the right person or specialist or professional that can help you fix that problem. So I'll follow this up with a phone call and give you some names, but it's not a big deal. It's just something that you have to help him work through, which he will work through. Okay, next question. Hi, Dr. Mike. Can you help me? I have been going to our pediatrician for 6 years, but he has been blowing off my concerns about my daughter's stomach aches. Can we come to you for a second opinion or just transfer over? How much does it cost? Thank you, Jill. Okay, so first of all, of course, we will help you. That's our job, to help you. That's what we get paid for. That's why we're here. We're supposed to help you. We're supposed to help your children, but we're also supposed to help you as parents help your children. So your first question, first couple of questions, can we transfer over? Sure, you can transfer over. I don't know if you would, I would encourage you to transfer over because you sound like have established a rapport with this pediatrician for 6 years. Is it possible to sit down with him and say, look, I've been here once or twice and you're not addressing my concerns. I'm really worried about this. Can you work with me? Or is there another option? Is there someone else in his office, another practitioner, that you can make an appointment with and say, look, I've gone to this doc and he's not addressing my concerns. Can you help me? That's another option. Can you come to us for a second opinion? Yeah, sure. That's easy enough. Come on over. You just call up and make an appointment, and we can give you our take on it. A lot of times we generally agree with the other opinions. It may be the way that they're presenting their conclusions to you sometimes, but you're welcome to come over. What is the cost? The cost is the same as whatever you would go to any other doctor's office or pediatrician's office. So it's more of whatever insurance plan you have. Your insurance plan would pay for the cost of the second opinion. If you have a question about that, if it's covered, which it generally is, you can call the insurance plan and ask them if a second opinion is covered, which it generally is. So there's no additional cost from you aside from what you generally pay if you went to an office visit at your pediatrician's clinic. So that's it. Okay, thanks very much. Have a great week, and keep the questions coming. Bye-bye.